There is an argument that the mental health crisis stemming from COVID-19 is serious and will be with us from time. And some people would argue that this is the hidden pandemic, that it is the fallout in terms of our well-being that will be the legacy of COVID-19. And so we need to do everything in our power to be able to support people to come through this as well as they can. The response to COVID-19 actually is no different to the response that we have to any other crisis, be it a terrorist attack, a natural disaster. And it's been argued that our response to a crisis goes through 4 stages. The first stage is what we call the impact stage, where people become acutely aware of the impact of whatever is the threat might be. After that, people move into what we call the honeymoon stage. That's at the point at which people start to believe that the threat is contained or eliminated, and they feel like they're going to get through this. Then the reality hits that actually getting through this means that it's not quite the same as it might have been previously. And for many people, they move into a stage of what we call disillusionment. It's that sense of the reality of what the loss has actually meant for them. And for some people, they will get stuck in disillusionment, but for most people, they will move on and start to see their lives returning to maybe more on the going okay or the thriving stage. So I would suggest that one of the things that would be helpful for people would be to use that mental health continuum anchored by thriving to unwell as a way of taking the temperature gauge of people's well-being. And it doesn't have to be done in a complex or over systemized way. It can be done in terms of a conversation. A supervisor taking a toolbox meeting, or a crew boss out in a forest could be talking at a tailgate meeting and saying, "How are we going, guys, today? Where are we sitting? On that scale, where we sitting? You might want to put some numbers on it. Are we a 1 today? Are we a 5 today?" And then ask the question why. It can be really helpful ways of just taking the temperature gauge around well-being in a very non-threatening and the key issue here being regular way, because it's an ongoing state that changes, so we need to do it in a regular way. I'd like to just touch base with the forum's sense-making framework. The framework is a useful one to look at what we need to do in terms of leading through COVID-19. The framework has 4 different approaches to addressing well-being, 2 of which are very clearly obligations and 2 of which have enormous opportunities for any workplace. The obligation is what we call protect, and it's absolutely an organization's obligation to identify risks to mental well-being and where the risks are to look for ways to eliminate and isolate. It's also the area where we can be looking at protective factors, where we can do a lot of good work around work design. Moving from protect, the other part of the equation is to look at what we would call foster work, where you are looking for opportunity to build the capability of people to deal more effectively with adversity when it comes along. And that's where you might see things like resiliency building training and what some people are referring to as mental first aid. Then there's another part, which is what I'm going to call the reclaim space. The reclaim space is where, if you think of the mental health continuum, people have been moving towards struggling and unwell, but they're not unwell. And with some effort, we can help them restore their well-being and start pushing them back towards the I'm going okay, thriving aspect of the mental health continuum. And the last stage of the mental health forum's framework is what we call the support approach. And the support approach is, the reality is we all will at some point in time be on the lower end of that continuum, and we will be feeling unwell, struggling or going unwell. And we might need some support in terms of access to medical help or some counselling help. And there is where we would want to have in place an employees assistance program or access to a chaplaincy program or whatever your organisation might have. But the key issue around this framework is that if we're going to be really considered about how we deal with mental well-being, we don't play in one quarter of the field. Any game, whether it be soccer or hockey or netball, if it's only playing in one quarter of the field, or the course not a particularly good game, we need to cover all our bases. So I would really encourage you to reflect on what you're doing currently to lead well-being, and to ensure that you are working across all four of those different approaches. You know the old saying, when you're on the plane and you need to put your oxygen mask on, put yours on first before you put it on your kids, because actually you're not good to them if you aren't able to breathe either. So think about it. What are you doing to design for your well-being? How are you managing the demands? Do you even know what the demands are on you? Have you taken enough time out to reflect on what might be the current things that are risking or putting your well-being at risk? And is there anything you can do there to eliminate or isolate? And is there anything you can do proactively to design the way in which you personally do your work in a way that has a positive impact and enables you to thrive? What are you doing in the foster space? What are you currently doing to build up your resiliency? And given, that I suspect you've been working extremely long hours, and it's been a stressful period of time for you in terms of managing your business and the well-being of your people as well. What are you doing to reclaim or restore your well-being? And here again, I always would suggest that you really reflect on the 5 Ways to Well-being, which is a framework for well-being that is sponsored by and supported by the New Zealand Mental Health Foundation, and gives some very clear ways in which we can very simply some very clear and simple ways in which we can actually weave well-being into our daily lives by staying connected, by being curious and being open to learning, by being active, by giving to others in terms of our time, our presence, our appreciation, our thanks. These are the things that can really make a difference to ourselves. So to what extent are you actually weaving some of those 5 ways to well-being into your life? And then lastly, if it has taken its toll, having the courage to put your hand up and say, actually, I need some help here as well, so that you may be also in a situation where maybe you need to access some support. Let's not just try and tinker around the edges and sort of try and shoehorn people back into the way we did work as close as they did previously. Let's take this as an opportunity to really reassess how our work is impacting on our people. And let's understand our obligations to protect them, and let's understand the opportunities we have in order to foster their well-being. And so that in a few years' time, I don't know what that time frame means, but let's say in the future, when we look back at this period of time, we can say, one of the good things that emerged out of that situation, out of that pandemic, was that we seriously looked at our workplaces and we made some changes, some significant changes, in that when we look at the impact of work on our well-being of our people, we can say we've done a good job. That would be a really positive thing to have come out of this situation that we're currently in.